your teenage child was just diagnosed with this thing called functional neurological disorder, short for FND, and then you are probably feeling lost, confused, and maybe even dismissed by doctors. I totally get it, because this is a new diagnosis, you don't even know what it is. But what should you do now? You cannot just do nothing. So in today's video, I'm going to walk you through exactly what you should be doing when your child was just diagnosed with FND. So let's talk about it. Hello there, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy, which is an online group coaching program to help teens with FND and their parents to resolve the condition so that they can get their life back and feel like normal again. Yes, it is possible, and I'm gonna walk you through it. How do I know that? Because I have helped hundreds of teens resolve FND and found this pattern. When a child is diagnosed with something like FND that no one knows about it or what to do about it, and then parent and teen have these common reactions. So I'm going to walk you through what they are and what to do so then you are not feeling trapped or stuck. So one of the things that I see a lot working with so many teens with FND and their parents, this is a common reactions that I would get. Most parents and teens feel, first of all, very confused after getting a diagnosis. It might sound kind of like this, like, what is FND? And that also includes PNES, NES, functional movement disorder, all of the above, okay? But I am making it as a super simplistic as an FND. So like, what is FND and why don't more doctors know what to do? Or what do you mean everything looks normal? My child does not look normal. Like, what are you talking about? Wait, what do you mean? EEG, CT scan, MRI, blood work, all of these things. What do you mean? It's normal. It's so confusing and very puzzling. Look, it is completely normal for you to feel if that is exactly how you felt, because once again, nobody knows what it is, including you, until you get the diagnosis of FND. Am I right? All right. So absolutely, your confusion and just feeling this panicky feeling is very normal because you were not expecting it. Yes, it could be a better news that your child does not have a brain tumor or something, but that doesn't make it any easier. You know, it makes it even more confused, right? In some cases, because what is it now, right? Now, I am here to assure you, FND is real. It is actually a known condition. But better yet, a recovery is possible, definitely possible. By the way, if you have any questions or any confusion or any initial reactions that you are having when you are just diagnosed with FND, leave me a comments because I read all of them. So now, FND is not just all in your head or something made up, like your child is making things up. You know, like, I think that your child is going to do rather something else if they want to make things up. You know what I mean? So yes, I get that. It is a complex brain-body issue, which I'm going to walk you through, influenced by so many different things: biology, psychology, and social phenomena. So it's not just one thing that is causing, right? But the problem is many professionals do not fully understand FND because it used to be considered this thing called convergent disorder, which is 100% mental health disorder. So a lot of doctors are like, oh yeah, FND. What they're thinking is, oh yeah, it's a convergent disorder. Yeah, it's all psychological. Yeah, it's all mental. Yeah, you just need to go see a therapist. Yeah, it's a cognitive behavior therapy or CBT. Oh, it's a trauma. Yeah, so you need to go see that therapist. Either way, that kind of thing. Okay, so there's a lot of misunderstanding about the FND. This is why it feels like there's no clear solution. Right? So you got sucked into it. So welcome to the club that you didn't sign up for. But I am here to say recovery happens when you take the right approach, okay? Which means understanding the mind-body connection. So it's not just one thing that is causing, it's not just biological, right? So if you are still thinking, oh my God, there's gotta be the vitamin D level is too low, or iron level is too low, or it's that bullying that happened. If you're just tunnel vision to one thing, you kind of got it wrong. So let's make this right once and for all this time. So here are 3 steps for you to take when your teenage child is just diagnosed with FND. So let's dive in. Step number 1, you have to educate yourself and then your teen. So what does that mean? The best thing you can do first is to learn, right? Because the more you understand, the less fear takes over. That's right. If you're feeling fearful or panicky, which I'm going to get to it, just No, the more information you have about FND or what you're dealing with, the less uncertain or less fearful you would feel. So make sure you're using trusted resources. Now I get it. Maybe you found this channel by relying on Dr. Google, right? However, there are a lot of sites and things and information that are out there that will probably get you to a lot of dead ends. So again, for one, my YouTube channel has plenty of videos that break this into an easy to understand way. Because if you don't have a good understanding, how could you explain that to yourself, your child, let alone other people, right? So I am all about, okay, let's break it down to practical skills and strategies and step by step, easy to understand way. So binge watch, you're welcome, all of the videos that's on my channel. And as I mentioned earlier, FND is a very common diagnosis in neurology clinic, and it is a communication problem between the brain and the body, even though your child's brain and the body are physiologically fine. So this is why, even though the symptoms of FND may look very scary and quite frankly pretty terrifying, your child's brain and body are safe. Actually, okay, they're not dying. Okay, yes, it looks like, oh my gosh, my child's gasping for the air, she's gonna die. I totally get that, and there is also the thing about secondary injury, like your child might fall, and then the fall itself can result in an injury. However, when I'm talking specifically about the FND symptom itself, just because your child is having this paralysis or having this vision disturbance or having this non-epileptic seizure event, it does not mean that your child is dying. Okay, so there's that. And FND is not just about nervous system glitch. It's not just about, oh yeah, as long as I could do the relaxation strategies, I'm gonna be fine. Well, guess what? That is very, very important thing. It's not the only thing you and your child needs to be doing. That's a good start, though. That's not all right? It's a lot more complicated than that. Again, FND is a biopsychosocial phenomenon. It's not just one thing that is causing the problem. You kind of have to know all of these things if you want to recover from the FND. Now, knowledge is power, right? And that power is what will help you take the next steps. So what is the next step? Once you get educated, you and your team, about FND, step 2, guess what? Don't panic. Relaxation is a key. Now, I know it's easier said than done. And I said it earlier, using the relaxation itself isn't necessarily enough. I said that. However, I also said that relaxation is the important thing to do, one of many, many things. But I would like you to start from here, because here's the deal. When parents panic, kids panic 1000% of the time. And that also includes, even though you're saying to yourself, well, I'm not showing my panic in front of my child. Well, guess what? Your emotion, your internal experience is a lot more contagious than any virus on the planet, period. And then your child, when it comes to kind of getting the vibe, they're top-notch observer. Especially for teens with FND, their brain is so keen to catch that kind of thing. And there's a reason for that. And they're not born that way, just so you know. It is a pure neuroscience, but they are more likely to pick up on those vibes. Therefore, don't fool yourself if you're saying, well, I'm not saying, I keep telling my child that I am fine and we're going to be okay. Absolutely great. And then you do that outside of your child's presence. That's what I'm talking about. So here's the deal. It's kind of like this. Like if you're flying, right? And then what if your flight attendant or let alone pilot, is just telling how panicky they're feeling when they're flying? Would you as a passenger feel super relaxed and chilled? I don't think so. If you hear the pilot saying, oh my gosh, we have this turbulence going on and oh my gosh, we're gonna crash, stuff like that, I bet you're not gonna be like, oh yeah, no, we're gonna be fine. No. You are going to be a lot more panicky and then trying to brace for yourself and all of that stuff. So that's why I've never been a flight attendant or a pilot, but they are trained to remain calm, right? So absolutely, you as a parent are required to remain calm. inside and outside of your child's presence. So related to feeling panicky, this is what I see all the time as well when your child was just diagnosed with FND. It's kind of like this throwing spaghetti at the wall syndrome, what I would call it, like meaning jumping from one thing to another in desperation only adds to the stress. So what does that mean? It's kind of like making appointments with 20 different doctors and see who can help you. I get this call all the time from families. Oh my gosh, my child was just diagnosed with FND a week ago and you are one of 30 different doctors that I am reaching out to. Can I talk to you and then see if we can work together? I would say, sure, I get that. You want the best for your child. However, making these relentless appointments will, number one, only overwhelm your child, especially if you or your teen don't know much about FND or what you're dealing with. Just think about it. Because you're going to be probably calling so many other people, and then I get it, and then I would rather you do that than like, this is not happening. Let's just see and how it goes, I'm just going to hope and pray. Well, guess what? FND is not a hope and pray solution kind of thing. Yes, absolutely. There's nothing wrong with hope and pray. I love hoping and praying. Absolutely. You need a little bit more than that though, when it comes to recovering from FND. Right? So you are likely, if you keep doing this, like, oh my gosh, one after another, your child is going to be exhausted on top of feeling already exhausted. And then here's the deal. You are likely get sucked into this so many directions. And I guarantee you will feel more confused and lost because again, you don't know what you're doing. You don't know what you're dealing with, and you're getting so many advice from so many different people, and it's actually good news, kind of like a good problem to have. However, this is like this: too many cooks in the kitchen, even though every cook is an expert in having a good intention of wanting to help you. However, if there are too many cooks in the kitchen, nothing is going to work out. Now, the worst case scenario, which is unfortunately what I see more, is the doctors being dismissive. Like, well, you've got FND, there's nothing to do, so see ya. And so if you can find one solution or one resource, great. This is what I'm talking about. The other side of the spectrum, like I have seen families making tons and tons and tons and tons of appointments and calling so many places all over the world. And I'm like, dude, okay, chill out, right? Don't panic, relax. Do one thing at a time. And while you're doing that, here's what you can do. You can practice your own relaxation strategies, whatever that is, whether it's a slow breathing, grounding exercise, anything to keep your nervous system calm. Remember, when parents panic, teens panic 1000% at a time. However, you remain calm will help your teen's nervous system settle as well. So this is where I say you are the secret weapon. I am not kidding. Okay, so that's a step 2. Don't panic, relaxation is the key. Step 3, normalize daily life with baby steps. Now, this also sounds like it's easier said than that, but here's the deal. FND makes teen feel like their life is on hold rather quickly, like overnight. So we want to change that mentality little by little. So it would look kind of like this. Yes, your child might be struggling with FND symptoms, rather fluctuating, right? And then one day it looks like this and next day it looks like that. It was going great on a streak of like a week or 10 days. And then suddenly, bam, something happens. Yes, that is the name of the game, which again is the reason why you really need to know what you're dealing with. You cannot just look for one symptom and then thinking that's all it is when it comes to FND. So back to normalizing daily life. Start by setting small goals, like going for a short walk, right? Or eating meals together as a family. Like your life is going to be so upside down. So start bringing it back to the normal, even though just a little bit. Or it could be something like doing an enjoyable activity for maybe 5 minutes, like a family board game, just watching TV together. This is not a time for you to leave your work, change everything, move and over accommodate, all of that stuff. Trust me, I know you want to do that. Devote yourself to help your child. Absolutely. There is another way to actually devote yourself fully without doing that stuff meaning like totally changing your life upside down. Again, we're not rushing recovery. I wish we could. However, keeping life moving forward one step at a time is the key to go, right? So know what you're dealing with FND and then relax yourself, right? And then that's going to help your teen calm down as well. And then normalize your daily life little by little, baby steps. Now, FND recovery does not happen overnight. I wish I could say that, but I'm not going to lie. One of the values that I have really strongly is being straightforward. So the fastest recovery I've ever seen in my career so far with FND was 3 weeks. Okay, 3 weeks of me working with this teen and the family back to back, and not like every day, but once a week. Bam, got better, great since then. But even then, that's not overnight, right? And that is very, very rare case. So most of the teens, even though you just got diagnosed with FND, is not gonna be overnight solution. I will tell you that. However, I've seen so many teens get better with the right approach. That I know. I have seen one too many times. I am so convinced that recovery is possible. Now, if you want more guidance, make sure to subscribe and then hit the like button so you know that you are getting more information out of my channel for you and your child. And if you want more information about how I help teens recover from FND along with the parent support just like you, then you can click the link below for more information. Now, thank you so much for watching this video, and I will see you in the next video.